Thank you for joining us on day 5 and final day of decoding the black box of cyber trafficking, what doctors miss, gynecologists, nurses, and what cyber trafficking survivors should bring up. And just as a recap, when we started day 1, we mentioned a statistic that was pre-pandemic about the number of times a woman is sexually assaulted in this country. And it turns out, post-pandemic, every 68 seconds, someone is sexually assaulted. And every 9 minutes, that person is a child. When it comes to cyber sex trafficking, that number is pretty much every 30 seconds. So the pandemic changed a lot. A lot of survivors of the cyber sex trafficking trade were pretty much in lockdown, locked in their grief, their different stages of grief in the moment, and not be able to get the assistance that they needed, and pretty much locked in the schedule of their pimp / trafficker / John at the time. And coming out of the pandemic, realizing that the pimp and trafficker and John still have leverage over them. So the purpose of this series was to bring awareness and to get community involvement, particularly in the medical field. Because that's where the survivors are going to meet, eventually come in contact with someone who they can potentially get assistance from. Our one cyber sex trafficking survivor was looking for answers. Looking for answers that what was happening to her was not a phenomenon, and that she's not crazy. So she was looking for confirmation. And unfortunately, that's what the medical community does not provide. So it's important that the medical community be made aware of this type of trafficking so that they can provide assurances to cyber sex trafficking survivors when they enter their doors. Because that can sometimes be the first stop to get them out of the life for good. And as a recap, some of the medical conditions they're going to be coming with is diabetes, pre-diabetic, weight gain, arthritis, inflammation, degenerative disc, nerve pain. And these are the idiomatic conditions that that the pimp and traffickers are imposing on them physically, remotely. Not to mention the STIs, the sexual transmitted infections, through the areas that they're stimulating the most for their Johns, or for the sexual gratification for the pimp or trafficker. And sometimes that comes with bruising. Sometimes that comes with tears. tears along the vaginal walls, tears along the anus area and sphincter. And you're going to see cyber sex trafficking survivors coming in with, I have blood, I'm bleeding in along the line of my anus area. And you know, the specialist is going to say, no, that's not possible. But with the idiomatic conditions that the pimp or trafficker is exerting on the survivor, it is possible. It is possible that they're exerting pressure along the blood vessels lining of the sphincter. Another condition, as a recap, they're going to be coming into the doctor's office, or who's going to refer them to the OBGYN, is overly blood flow. And that could be two reasons. One, the overstimulation of hormones within the survivor's system that could potentially have caused a fibroid, cyst, or exasperating the condition that the survivor already had so that there is massive blood flow. And just so the survivor can get up in the morning and exist, requiring curbing that blood flow so it doesn't take up at least most of someone's life, at least 3 weeks of someone's life. And we didn't mention it on the day that we had covered this, but some of the times, and one survivor had described it as like blood vessel jelly. Gobs and gobs of blood vessel jelly. Just picking up, just jelly that's coming out on the panty liner or pad. So, unfortunately, when presented with the GYN was like, okay, what do you want to do? So they're not asking the questions. Are you in the trade? Do you have multiple partners? How many times are you sexually involved? How many times are you sexually assaulted? And a next question that should also be asked is, do you want to get out of this life? Do you want to get out of this trade? And another thing is, do you have an embedded chip in you? So these are new questions to ask post-pandemic. To safely diagnose our patient correctly and to get the survivors the assistance that they need. And also to confirm to them that, what's happening to them is real. They know it's real, but they need that acknowledgement that someone else has acknowledged that what they're going through is real. Now, we mentioned how the pimp and trafficker engages with our survivors. But they communicate not only through sexual assault, but also verbally with our survivors. They do intimidate them verbally. So they're getting verbally abused and intimidated just as much as they're being sexually assaulted and experiencing sexual violence. Particularly when they try to get out of range of where they cannot control our cyber sex trafficking survivor. And sometimes that communication is nonverbal, and sometimes that communication is verbal. The nonverbal communications are the ones that's going to show up at the doctor's office. Blisters on the feet. Bruising on the skin. These are the nonverbal, idiomatic conditions that, your patient may come in and may not make any effort to cover it up. And you may question, how do you get this bruise underneath your feet? It's like a hematoma, like a blood vessel underneath a sole or the pad of one's feet. And the survivor's going to say, I don't know. It's just appeared one day. But depending on one's medical coverage, it determines what kind of treatment our survivor has. And this is why we also bring this to your attention, to probe deeper and use your different lighting, blue light, purple light, to uncover the bruises that appear on the skin, on skin tones that are fairly darker than most. And that's another opportunity to ask the questions. Ask the questions about, are you intimidated by your partner? And they'll let you know whether he's a partner or not. It's just someone who messes with the survivors. Sexually harasses the survivors, intimidates the survivors. Get them to engage in sex acts without consent. We also mentioned on our series this week that not all survivors know their pimp/John/trafficker. And largely it's because how they were selected by their pimp and trafficker. Either they drugged their drink or injected them with something because they fit a profile that the trafficker pimp wanted or the John wanted. This is all fairly not new, not nuanced, but at the same time, a John may put a request in what his preference is, and the pimp and trafficker is looking for someone who fit that type. They're going through a lot of trouble to fit that type. But for cyber sex trafficking, because they have audio communication as well, they want the trafficking target to engage with their John as well. And so they're looking for a type, a certain type at times, depending on the John and the bid that's put in. It's a new world out there where someone puts in a bid for someone or some type, and the pimp and trafficker tries to fulfill it in some gross and grotesque way. And somehow someone is pulled out of their everyday life into this, a world of trafficking. And are intimidated every single day, sexually violated every single day, so that the pimp and trafficker exert full control over them. Not only over their body anatomy, but also mentally. And some of the comments that the pimp and trafficker leaves with our survivors are comments such as, "No one's going to believe you. You can't get away from me. I own you now." Hearing this day by day does a lot on the psyche of our cyber sex trafficking survivors. And it takes an inner iron will on our survivors' part to know different, to remember a life before being trafficked. And part of the demoralization that the cyber sex trafficker survivor goes through is the fact that when they seek out help and assistance from either their faith-based group or religion, and they go to these places, what do you think the pimp and trafficker is going to do, right? Not only are they going to use their non-verbal communication, which causes, nerve pain when they go see someone of their faith, and they go to institutions of faith, they're going to experience a sexual violations there as proof that their faith is not going to help them. And you will hear pimp and traffickers say that. No one here is going to help you. They even take on the role of their creator. Sick, but this is what they do to the survivors. And I think that is common for most trafficking survivors, where the pimp trafficker takes on the role of a higher power in order to exert that much grasp on the survivor's mental space. So when the survivors enter these safe spaces, like the medical doctor's office, you have a chance to not only observe what's happening under their nails, fingernails. Fingernails are also letting you know what's happening internally, because there are system imbalances that's happening with our survivors. It lets you know if there's any anxiety going on with our survivors who are nail biters. It opens the door as to what's worrying them. It also lets you know, if you ask, Do your nails grow out? Because it lets you know if there's any imbalance. Every time my nail grows, it breaks off. It breaks off every time I grow it. I grow it a little bit, it just breaks off. Another idiomatic condition of the pimp and trafficker, just exerting stress on that anatomy and having it surface on hair follicles, hair growth, lack of hair growth. These are the idiomatic conditions that present themselves in the doctor's office. And it could be related to stress because of what the pimp and trafficker is exerted on them, or it can also be that nerve inductions that the pimp and trafficker is exerting with the biosensor that's interfering with the hair follicles when they come to you with hair loss, premature hair loss, and then they're being diagnosed with a medical condition now. So there are myriads of idiomatic conditions that our cyber sex trafficking survivors are coming in to you for. And some may be missed if you don't ask. And for one survivor used to shave her legs almost every 2 weeks. Since being chipped by this biosensor and entered into the life of trafficking, never had to shave her legs. Never had to shave the armpits. So asking these questions are just like clues into what is happening into the systems of your patients who's coming into you. And this is your opportunity to get them the help and assistance that they need. Some are going to be brave and answer all your questions directly, and some will not even open up their mouths. They're relying on you to find out about their pimp and their trafficker somehow, through some medical diagnostic test. And this docuseries was created because we know that's not the case. The medical community have set guidelines and, a cost analysis. And the survivors are left out of the loop unless we can include them in. And so the reason why we mention some of the safe spaces that the pimp and trafficker follows our survivors, your patients, is because these are the questions that you can ask. You can ask if they're in the life, but you can also ask, did someone follow you here? That's a good question. Did someone follow you here? Is someone monitoring this doctor-patient visit today? That's a very good question, because pimps and traffickers keep their survivors on a tight leash, particularly if they're being sexually violated remotely. And they go on overkill. They may tag the survivor's bag, and they may tag the survivor's phone in addition to what is on the person of the survivor. They go on overkill. So asking these questions are going to open up a whole slew of answers if the survivor opens up. But it could be a doorway for the survivor who wants to break out, who wants to leave. So, did someone follow you here? Are you able to speak freely? Are you being monitored at home? Are you being monitored here in this visit today? Are you safe everywhere you go? Questionable, but this is in terms of a pimp or trafficker. And since we're going on safe spaces, it is safe to ask these questions because this is what the pimp and trafficker wants. They want power and control. So asking these questions, are you free from sexual intimidation when you're at your place of worship, at school, at gym, and on ride shares or public transportation? Those questions are fair game. And it'll open the door for our cyber sex trafficker survivors to speak. Because that's so abnormal. And it's only unique for our cyber sex trafficking survivors. It sets them apart from other forms of trafficking. Whether John and pimp and trafficker has access to them 24/7. So those of you in the medical community has this power to free the cyber sex trafficking survivor, ask them the pertinent questions they need, and perform the diagnostic tools they need to be free of the life of trafficking, cyber sex trafficking to be exact. And the purpose of this series was to bring this to your awareness so that post-pandemic, the cyber sex trafficking survivors will get the help and assistance they need. And that they survive. And to make sure that there is no interference with one infection, idiomatic infection, from another idiomatic infection, and the drug interaction, and treating one infection versus another, making sure that doesn't happen. There's no overlap, so that the immune system of our cyber sex trafficking survivor is not compromised, so that if there's another pandemic, they have a higher chance of surviving. And post-pandemic, we're looking to see that more cyber sex trafficking survivors make their way into the medical community so that they get the care and that the questions get asked so that they can live. because this is a ticking time bomb. During this week, we also touch on our technicians, our feminist techs that is needed to help our cyber sex trafficking survivors to halt and stop that A to B remote sexual violence that the survivors are going through. You know, when this technology was formed, it was formed to build on what you call friendships, relationships, but it's just exploiting women, girls, those who are in vulnerable populations, and marginalized groups. Again, it wasn't made ethically with a lens of gender-based violence. So the conversation is going to shift, but right now, shift towards, AI ethics, gender-based violence protocols. But that conversation that should have happened years ago is just happening now. But at this very moment, our cyber sex trafficking survivors need feminist techs to break the bonds, the virtual bonds between their pimps and their traffickers and their johns. And they need to do this in real time. And that was another focus of today's and the docuseries. And so if that's you, if you're that tech, that feminist tech, that's going to help the survivors break those virtual chains and get rid of this virtual infrastructure, then sign on board. Follow the link on this podcast wherever you view it and join the fight with the survivors. I want to thank you all for taking the time in reviewing our podcast, Decoding the Black Box of Cyber Sex Trafficking, what doctors miss, nurses, gynecologists, and what cyber sex trafficking survivors needs to bring up to their physicians. And thank you for those who are signing on to combat this systemic violence. Thank you.